Please join, but I have sent the link. Yes. Okay, but see, now you are finding in the front of the leg, we have anterior tibial artery, which is one of the branches of popliteal artery. It runs between the muscles of the front of the leg. So what are the various muscles we see in the front of the leg? We have tibialis anterior. We have extensor digitorum longus, extensor hallucis longus, peroneus tertius. So it runs between these muscles. It runs below this retinaculum. This retinaculum is extensor retinaculum. Okay, it runs below extensor retinaculum. Okay, and so it is running over the dorsum of the foot. So the name of the artery has changed when it is moving from the front of the leg to the dorsum of the foot. When its journey has begun, the same artery is now named as dorsalis pedis artery. Why it is named as dorsalis? Because it's on the dorsum of the foot. Okay, dorsum foot. That's why dorsalis pedis. This artery is quite superficial. You can feel and check your own pulsations here. In case if there is something wrong with our radial artery, we can check pulsation even with dorsalis pedis artery. Okay, so that is the concept of dorsalis artery.
Ma'am, dorsalis pedis artery in between first two fingers, ma'am.
No, it will not go up to fingers, beta. Anta dooram
Pulsations, ma'am. Pulsations, ma'am.
Yeah, you can check with the help of these 3 digits. First row or else in.
Yes, ma'am.
Yeah. You got the idea, right? So how that goes. So see here, beta. So this is our anterior tibial artery and now it has come into the dorsum of the foot. So in the dorsum of the foot, you can see it is just coiling like this. So this is nothing but dorsalis pedis artery. The branches are, it will give like, what are the branches you remember? It has medial dorsal, lateral dorsal, and then this artery is arcuate artery. The one which is arching, you call it as arcuate artery. From the arcuate artery, you are finding metatarsal arteries. From the metatarsal arteries, we will see phalangeal arteries. So though this is a small diagram, but labeling is here. That's the reason I have shared, but I will also share the other picture, which gives you the concepts. See, this is anterior tibial artery and the one which is shown in green color is actually dorsalis pedis artery. So it will give branches to the ankle joint. So we have medial tarsal branches, we have lateral tarsal branches. This is arcuate artery like an arch. Then these are the metatarsal arteries. From the metatarsal arteries, we have phalangeal arteries also. Okay. So these are the branches. Just check once, you will understand. Okay. So let's go. Okay, but any more questions? I discussed everything what Puram has asked. Common peroneal, sciatic, femoral, dorsalis pedis. In order to complete, we can also check with obturator nerve. Because that also comes from femoral thing only, no? Let me tell you obturator nerve also. Obturator nerve is supplying which compartment?
Medial compartment.
Yeah, medial compartment. Very good. Okay. Kirti, please repeat the muscles. Muscles of medial compartment, beta. Adductor longus. Okay.
Adductor longus.
Okay, the medial compartment muscles are adductor longus, adductor
longus,
magnus. Okay. So the other muscles which are supplied are also like we have a twig going to obturator externus. We will see now. Okay. basically, when you go with this plexus, so what is this plexus? We have seen this was our lumbar plexus. So from the posterior divisions, we have seen the formation of femoral nerve. Root value is L2, L3, L4. Same thing from the anterior divisions, you see the combination of anterior divisions, again L2, L3, L4. We will see the formation of this green nerve, L2, L3, L4. What is the name of this green nerve?
Obturator. Obturator nerve.
Obturator nerve. So anterior divisions are joining to form obturator nerve, posterior division, same L2, L3, L4, posterior divisions are joining to form femoral. Femoral is supplying front of the thigh, obturator is supplying medial compartment of the thigh. Now let us see the medial compartment distribution. Now see here, see this medial compartment of the thigh, you see this is our obturator nerve, it runs like this and it supplies the adductor longus brevis magnus. Okay, let us see gracilis also. There is one very good picture, beta, which will help us. Actually, this is something like line diagram. Once you know the muscles, so in correct way, you know the names of the muscles. Once you know the names of the muscles, now you should also know like how the obturator nerve is supplying these muscles. So the root value of obturator nerve, L2, L3, L4, it is coming out through obturator canal, which we see in the hip bone, and entering into the medial compartment of the thigh. Once it enters into the medial compartment, it is dividing into two divisions. What are those? Anterior division.
Anterior division, posterior division.
So anterior division is supplying pectineus, adductor brevis, adductor longus, and gracilis. Please learn this picture. This is from Vishram Singh. In every book it is given, beta. Obturator nerve is important 5 marks question. Okay. And this is posterior division. Or you can take photograph of this or screen record, whatever is convenient for you. So this is posterior division of obturator nerve. What are the muscles supplied by posterior division?
Obturator externus, adductor magnus.
Very good. Adductor magnus. Okay. Then you will see actually adductor brevis is shown in between. That means it can be supplied either by anterior division or by posterior division. Not by both, either anterior or posterior. Hence it is shown in the middle, adductor brevis. Okay. Then, so this anterior division, if you see further course, it is becoming cutaneous to supply the medial aspect of the thigh. And this is our posterior division. This is also becoming like cutaneous and supplying, it's giving a tweak to the knee joint. Tweak to the knee joint. So just give the basic information drawing this picture, beta, how the obturator nerve is formed. Then try to figure out what are the various muscles you see in the adductor compartment. Try to check how actually they are seen in our body. This is the medial aspect of the thigh. You are finding adductor longus brevis magnus gracilis muscles. Then you can actually like list it like this, like anterior division, posterior division, what are the various muscles. You can also draw a picture like this and give a clear-cut explanation. Suppose if obturator nerve is damaged, what will happen? Obviously, adduction of the thigh is lost. Person will not be able to adduct the thigh because adduction is brought about by obturator nerve. There will be sensory loss along the medial aspect of the thigh. Okay. So that is what is all about obturator nerve. Okay. So send me a few questions from physiology also, beta. So I will send the link for physiology now. Okay. Puram, you send or somebody, beta, please make it fast. Anybody, you decide.